Hello there, selamat pagi my friend. Today I want to discuss with you about a video that went viral recently. First, let's watch the video.
What do you do for a living?
Hi, I'm a pediatrician, consultant pediatrician. I think it was like 15, 16 years back. My basic pay was just about 2,500, and plus the allowances, I will get around 4,000.
So what was the salary like in the government and now?
Yeah, it's a high jump. So I guess 4 times from my government salary to private sector.
So how much do you make now
About 60, 70K
per month?
per month. I mean, when you are a consultant in government, maybe you get about, the most will be 16 to 20K.
So, what happened here? Well, this pediatric specialist doctor shared about the salary gap between the specialist doctors in government hospitals as well as the private hospitals. The government hospital specialists, they are getting around 16 to 20K ringgit as their salary versus about 60 to 70K ringgit per month as their salary in private hospitals. Well, here I would like to emphasize that this is all about specialist doctors. In government hospitals, the GPs are still getting very low pay, starting at about 4,000 ringgit. Pediatrics, well, they are indeed still child's play, I would like to say it. In private hospital, I have heard that orthopedic surgeons, they are getting about 100 to 120K per month as their salary. And that's orthopedic surgeon. Let alone, let's say, cardiologists or even neurosurgeons. They can only get higher from here, right? Well, cardiologists and neurosurgeons in the government hospitals are still getting the same 16, 20K salary in government hospitals. What problems will it cause? Now, experienced government doctors are more likely to be moving or shifting to the private hospitals. Just see, in the government hospitals, they are earning 16 to 20K ringgit salary, while if they are in the private hospitals, they can earn 60 to 70K or even 100, 150K salary. Now, how will they feel? What can still drive them to do their work? You say compassion? You say to service the less fortunate community? Can the doctors make a living on compassion alone? Well, to be honest, how many doctors can be so charitable, right? So further down the road, the government hospitals will be short of experienced specialists in the long term, and the standard of care in government hospitals will be difficult to improve. Also, patients have to face lengthy scheduling periods to see a specialist in the government hospitals. It can even be months down the road for each appointment. And while they are there, they need to endure long waiting time. Lastly, the specialists in the government hospital will face increased workload, increased pressure, yet their income does not improve. As a result, many will resign and move to the private sector, forming a vicious cycle. Why did this happen? In my opinion, this is because public hospitals and private hospitals, they are two parallel systems with no intersection. Let me explain. First, let's talk about the public hospitals. Now, public hospitals, they are always losing money for the government. And in order to keep them running, the government need to subsidize them. They have very low charges. So the patients they see are usually those without medical insurance and those who are from the middle to lower class of income of people. Now, they will always have insufficient rooms and beds for the patients, and they will always have shortage of specialist doctors, GPs, nurses, and other personnel. And due to that, it will give a very poor experience for the patients while they are at the hospitals. For example, long waiting time, and they may need to see a different doctor every time they go for follow-up, needing them to explain their condition over and over again. In contrast, now let's talk about the private hospitals. Private hospitals, they are profit-driven, right? They want to earn money. So the patients that they see are usually those with medical insurance or those who are from the middle to upper income group of people. They have low utilization rate for the rooms and the beds for the patients, and they will always have sufficient specialist doctors, GPs, nurses, and so on. So when they are charging higher, but at the same time, they will be able to provide a better value, better experience for the patients. For example, short waiting time, better rooms, better condition, and they can even appoint to see the same doctors every time they go for their follow-ups. After comparing government hospitals and private hospitals, we know that in the long run, it is not sustainable for the government hospitals in this situation. So, how do we change this? The simple way to say it is actually, nobody can change the current situation. What do I mean by that? Let's discuss this in detail. My approach, my suggestion will be to blur the boundaries between the government hospitals as well as the private hospitals. The other way to put it is to increase the charges for the government hospitals while decreasing the charges for the private hospitals. How do we achieve this? First, we can set up a government fund. Let's call it National Health Fund. Then we can use the money in the fund and distribute fairly to both public and private hospitals. How do we get money into the fund? The fund can be sourced very similarly to income tax, EPF or KWSP. It can require a mandatory deduction of a percentage of monthly income of a working person. Maybe we say 5%, 8% deduction and put the money into the fund. Then we abolish the full subsidy system in public government hospitals and switch it to a paid system. Then we can operate the hospitals as non-profit organizations. The patients, regardless who, they can visit the nearest clinic or hospital for their medical needs, for example, ailments, road traffic accidents, chronic disease follow-ups. They do not have to consider whether a hospital is private or public. Their expenses will be covered by the National Health Fund. And you may be wondering, how about those less fortunate group of people? For example, the elderly people, children, and the vulnerable groups. They can be paid by using those who are contributing to the group, for example, the working people. And now we have PADU, right? PADU can be responsible for identifying and collecting the information of the individuals who meet the criteria for the subsidy. Now, next question will be, how do we ensure the profitability of private hospitals? How do they still make money in order for them to keep operating? Because they are for profit. We can set up a specific percentage rate. For example, probably 60%. 60% of their patients must be covered and paid by the health fund. Then the remaining 40% of their patients, they can be paid personally or by insurance. Now let's talk about the pros and cons of such a revamped healthcare system. First, what are the benefits? We can balance the salaries between the doctors in both private and public sectors, and we can reduce the tendency of the specialist doctors in the public government hospitals moving away and moving to private hospitals. Because now the government hospitals are charging the patient by using the fund. They can have a source of income, and once they have that fund, they can increase the salary of the government hospital, reducing the tendency for them to move away and retain them. Then we can reduce the patient overcrowding in the public hospitals, because now a portion of the patients are now flowing into the private hospital. And by doing that, we can increase the utilization rates in the private hospitals. For example, for their beds and equipments, they can have better utilization rates. And by doing so, we can distribute medical resources more equally because they are more used by both sectors. And most importantly, we can reduce the government financial burden. Let me give you some data. Last year, in 2023, the total healthcare expenses borne by the government has amounted to be 36.3 billion ringgit. That is a lot of money. Now, what are the disadvantages, you asked? Well, in order to set up this National Health Fund, you have to take money from the people's pocket. Another way to say it is, you are taking money from the voters' pockets because you have to deduct their salaries, right? So this move is actually considered as a move for political suicide. That means whichever party, whichever government that do this, whichever government will tumble and be gone in the next election. We have actually an example of this. The Najib government, they proposed this actually back in 2012. It was called One Care. The plan for this One Care was so opposed and it was so overwhelming that the government in the end, they U-turned and cancelled the plan altogether. Let's bring this video into a conclusion. The government medical subsidies are, to me, very much unsustainable. With the economic growth of the country, it brings population growth and also increased lifespan of the population. This will add a huge burden to the healthcare system, causing the government subsidy expenses to rise a lot year by year. To maintain the medical standards of the public hospitals, it is necessary to move towards a system that is very much of a national health fund kind of system. But pursuing this direction may also be a political suicide. So this will lead us to nowhere because nobody will do it. What is your suggestion? Feel free to leave a message down in the comment section and share your thoughts. Maybe we can have a discussion down in the comment section. Well, I hope my video inspire you to have some ideas. If you think so, please give a like and give me some encouragement. I'm Gigi Han, Dr. Han, and I will see you next time.